Hello, let's reason once more today. We are talking about antenatal care. So, every pregnant woman, this particular video should excite you. So, essentially, we want to know is it worth it to actually attend antenatal care. So, what's important in this video is that I want to state clearly that sometimes women tend to walk into the obstetric clinic maybe around 28 weeks and they are coming for antenatal care. So sometimes we call them experienced mothers because she has delivered one, two, so she believes that there's no reason why she should be early for antenatal. Okay, but let me take us a little bit down the history about antenatal care. The first model of antenatal care usually is the traditional model, whereby a woman from the recommended day of starting antenatal care, say previously about 12 weeks, she should have at least a total of about 12 visits before she gets to her EDD, that's expected date of delivery. All right, this was in furtherance looked into, and the focused antenatal care came into place, where this total visit was reduced up to just 4 visits for basic, for antenatal care, for those who do not have any problems. But the low risk profiling and the high risk profiling was difficult to know when will a woman move from high risk to low risk and all that. So later on, there was in 2016 about a recommendation by World Health that let this, visits be up to say 8 visits in total. But the problem here is the issue of visits. So one of the things that the bulletin talked about is, should we really be calling it visits, antenatal care visits, or should it be contact? Now, it makes a lot of sense. I might decide to just visit you, might come into the place, say hello, hi, is everyone, and I will go. But if there is a contact, that means we really possibly have some discussion. You ask me, you tell me your problems, I'm able to solve them and all that. So there is better to use the word contact more than visits to show that you actually have some interaction with the healthcare professional. Now, what is the recommended timing that antenatal care should start? Usually this question keeps coming up during the clinics, and this is what I tell the women. Once you know you have missed your period, I advocate that you should come to the hospital. There's a reason why you should come. One of the first reasons, one of the first differential, if any woman of reproductive age will be defined by World Health as between ages 15 to 49 years, if there is a missed period, one think about pregnancy. So if the woman is said to be pregnant, we want to first of all find out where is this pregnancy. This is so essential because when a woman decides, I am an experienced mother, I don't want to come to the clinic, that is when we don't usually capture the ectopic pregnancies. So, but if the woman comes by first missed period, before we used to talk about second missed period, but first period, please come, first missed period, let us check if you are pregnant. If you're not pregnant, fine. Sometimes you can wait it out and your period, comes back. So let me go back to what I was saying. So if there is, this is the period we do what we call localization scan, okay? So by the 5th week, 6th week, we want to localize where is this pregnancy. Is it actually intrauterine? So this is very important because when it is intrauterine, that is inside the womb, it is reassuring. We now say, okay, fine, the pregnancy can continue. The next scan we're going to do for you is to know what we call viability scan. Is the pregnancy viable? Is there any heartbeat? All right. Once we see that, you say, oh, great, fine, this woman is coming. Usually we can see every 2 weeks until we get to, before now, the current recommendation by NICE guideline says 10 weeks. Before we used to say 12 weeks. All right. By then, you should start your antenatal care. Then, of course, the visit is defined by your obstetrician. Remember that I said in 2016, the recommendation for Antenatal contact is just 8 visits. In these 8 visits, there are intensive things that you should do. So your obstetrician might decide to modify depending on the local balance. There might be some modification in these 8 visits, within which we do all sorts of things. All right. So now the question is that, should I worry if I don't start antenatal care early? Yes, you should, because you have already missed out a lot of things, a lot of the initial that is supposed to, be done for you. If your pregnancy were localized, you have had viability scan and all that, one of the few things you should also benefit by being early enough is what we call NT scanning, nuchal translucency scanning. Now, Down syndrome is one of the things you should note the trisomies, okay? This can be done, and there is something we are looking out for in terms of some measurement around the neck of the fetus. You can miss this anomaly scan, and we want you to be there. In some clinics, this is not even discussed, but of course, in very high specialist gynecology clinics, we are going to discuss this with you, all right? Now, if it is a twin gestation, remember, between 11 to say 13 weeks plus 6 days, we are going to do what we call chronicity scan. This chronicity scan is so important because when we don't capture how the placentation, of what we call chronicity of the twin gestation, it becomes very difficult to know whether they share the same placenta, whether they have different placentae. And I will tell you most solemnly that this is so important in decision during the management of that twin gestation. So when we know that this particular fetus or fetuses, they share the same placenta, the management is different. When they have different placenta, the management is different. And you can only know at this early stage. But when you are at home, you are feeling good, you're an experienced mother, you miss out all these things, all right? And of course, in terms of medication, all right, in terms of medication, there are some medication we will start at a particular time, the early phases. You might miss out all those and all that. Then some interventions. For instance, if a woman needs what we call cervical sacrilege, here is a woman that have had a history of every time the woman is missing pregnancies at, let's say, mid-trimester, around, say, 14 weeks, she will lose pregnancy, painless, and pregnancy is out by 15 weeks or 16 or 18, 20, 21, and all that. Pregnancy is lost. So such woman will be captured and will benefit what we call prophylactic cervical sacrilege, where the womb will be tied with some special tape. If you don't come early, you'll be missed out, and this will happen again. Some people will say it is from the village and all that. No, it is because there is no proper counseling. Such a woman did not really plan out, did not come early enough for intervention to take place. So the essence of this video is one, first of all, please ensure that antenatal care is something you must do and you should do it early. Secondly is for you to know when to come. Remember, we said immediately after the missed period that you should come to the hospital for evaluation. Thirdly, remember that the scanning should be done by the sonologist, or of course the gynecologist or the radiologist, to tell us where exactly this pregnancy is, what we call localization scan. Then we should know whether this fetus is alive, all right? And that is very important, what we call the viability scanning. Then after that, we should know, whether this fetus is a 1 or 2. When there are 2, we should determine whether they share the same placenta or they have different placenta for different individual management protocol. Then you should also know that there are some special drugs that we can give you early, a part of the pregnancy to safeguard this particular pregnancy. Then do not forget that we should also know at this early stage, in terms of placentation, like I said earlier, and to know the type of care that they will give to you. Then, of course, for those who are going to benefit for cervical sacrilege, whereby we do some surgical mini procedure at the mouth of your womb, what we call the cervix, to hold it. If you don't come early, we will not be able to do this. So the point is this: once you miss your menses, you miss your period, please come to the hospital for proper evaluation. Let me know whether you have any concern on the comment section. I'll be most pleased to answer your questions. Till next time, peace. Bye.